Welcome to the Research Works podcast. My name is Dr. Dana Poole and I get the privilege of bringing to you a very special series this week. I am here in Slovenia at the European Academy of Childhood Disability, interviewing the researchers and presenters about their work. This is very exciting and I can't wait for you to delve into this whole research conference series. We hope you enjoy the series. Welcome back, everyone, to a special series of the Research Works podcast here in Slovenia, EACD 2023. I have yet another wonderful person to introduce to you guys today. It is in the middle of the lunch period, so you can hear the hustle and the bustle of everything that's going on. We have our food set aside because yesterday none of us got to eat, so we've got our food set aside. We're all ready to go. But welcome, Miss Aisling Ryan. Thank you for joining us today.
Thank you. Very excited to be here and meet you in person after hearing your voice.
It's so nice to be able to speak with people who've been listening to the podcast, but also to be able to start highlight your work too. So you're a PhD candidate to the University of Queensland.
Yes.
Partway through, how's the journey so far?
It's been wonderful. I'm very lucky because I have a really great team of supervisors who I really admire and are really passionate about my topic, and also I just love talking about it. So
well, that's perfect
convenient
to come onto the podcast. It's wonderful. Well, the presentation that you got to present at the conference is titled Expert Consensus on Optimal Child-Led Goal-Setting Practices for School-Aged Children with a Disability or Delay. And it's an International Delphi Study.
Yes.
So many gold words through all of that. I've been saying that to all the presenters. I'm like, our titles are really mouthfuls, but they tell us so much about what it is that you actually did. But how about you sort of step us through sort of how you found yourself in this place when you're actually investigating this particular topic?
Sure. So I'm a pediatric occupational therapist.
Lovely.
I've been working in practice for about 14 years now, and in a number of different settings, but my passion is working in the community with children and families. And through my practice, I really became interested in how we decide what interventions to use with children, and some of the interventions that we know now have a lot of evidence seem to have goal setting as part of their sort of active ingredients.
Yes.
So I became more interested in that, but particularly around self-determination theory and what's children's motivation to take part in therapy.
Yep.
So I had a clinical interest already in that topic and have been exploring in my own practice involving children in goal setting and really having interesting clinical findings, and that parents were really surprised at what children were able to come up with. But I really felt that there was a lot I didn't know about if I was doing it the right way and what's generally happening in clinical practice. And so I became more interested in research and pursuing a PhD, that really stood out to me as my clinical question.
That's so good.
How can we help children to be more involved in goal setting, and what are the tools and approaches that support their involvement?
I love that. I think when you are working clinically and you love an area that you're working in, you identify a gap, you start asking questions, it becomes this niggling, annoying thing that you kind of go, I need to find out the answer to it. And it brings you to a place where you're doing your PhD. So congratulations on that.
Thank you.
And love how you've been able to talk us through that journey for you to be here. Now let's get into the actual presentation itself, but let's start by talking about what an International Delphi survey is, because that is obviously a very big part. That was your study design, but talk us through what that involved.
Sure. So the Delphi study is a common technique used in health research, which aims to gather expert consensus through an iterative process.
Great. Yep.
And why we decided to use that approach is because before we had conducted a systematic review on child-led goal-setting practices, and really what came out of that is that child-led goal-setting practices are not very well described. And we really felt, though, that clinicians in practice are probably using lots of lovely approaches themselves and have lots of knowledge that they could share. And that led us really to that Delphi approach. And what we really tried to do was gather a multidisciplinary perspective. So although I'm an OT, my supervisory team are made up of an OT, a physio and a speech therapist. And we know that in clinical practice, what works best is when we're working together. So we really wanted to gather that multidisciplinary perspective from a wide variety of therapists and researchers from across the world to help us answer that question about what should we be doing to help children be involved.
And it kind of is so reflective of the fact that we are are, as researchers, putting a lot of value on people who are working in the industry, because that's sort of really reflective of the, it's the finger on the pulse. It's knowing what's actually happening there and learning from each other. So, yeah, I think the Delphi study design is such a great design to be able to involve and gain those perspectives. So now let's go to the optimal child-led goal-setting practices. Just talk us through a little bit more about what that actually means.
Sure. Yeah. So we had a number of different factors related to child-led goal setting that we asked participants for their feedback on. And I guess that was to cover multiple questions that we had about how should children be included in goal setting. So when we talk about child-led goal setting, what we're talking about there is that children's preferences and views sort of come first, and that they're included and their voice is important in that goal setting process. So we asked therapists about who should be included, acknowledging that it's probably not just the child, and how they should be included. How do we know children are ready to be involved in goal setting? So what factors tell us that we can perhaps include a child? What's the process that we should follow? So the steps, are there strategies that help children to be involved? And what are the tools and frameworks that maybe can guide clinicians to involve children? So there was a bit of a breadth of areas.
And I love how you just rattled it all off without any notes because it's all in your head.
Oh,
so
I just
was so good.
So
I know.
how
good is that? So let's get to the all-important findings. What did you find through all of these?
So we had really interesting findings. We had 60 participants take part from across the world, so 9 different countries. They represented 6 different professional backgrounds, so really nice variety and the perspectives there, and also a lot of experience, so that ranged from 5 years to 50 years of professional experience.
How lovely is that?
And quite a, we had median, I think, of 20 years clinical experience. So a very experienced group. And where we had really strong consensus were the items that were related to the steps and strategies that participants recommended are used to involve children in goal setting. So there's a really big list, so it's really hard to give you all of that information off the top of my head. But in general, definitely participants agreed that children should be included, and it's really important to communicate directly with the child to understand what's important to them, their strengths and challenges, what they want to do more of or better or differently. So that was a really key theme. But also that you might need to prepare a child first. I guess as we could imagine, it's not so easy to just ask someone,
say, what's your goal?
Even if someone asked me, what are your goals? Out of the blue, I would probably find it difficult to, and I'm able to communicate very well generally. And so, with children who may be younger or have communication and cognitive difficulties, it was really important to participants that we prepare the child first by explaining the purpose and process of goal setting, understand their communication abilities, how much they want to be involved. And the other, I guess, big theme that came out was around, understandably, caregivers and parents and the family role, and that still is important even when we're understanding the goals of children, that parents can help to support children's participation.
And
we may
it's part
need
of the context.
Definitely. And also that we may need to negotiate between the child and the parent when their goals are different. Which I think is really important for us to think about as clinicians, because we often do come across the fact that parent and child goals aren't always the same.
That's true.
And that may be an important step in this process.
It's so worthwhile acknowledging that, because we had early on the show, Stacey Cleary was here, and she was talking about that tension. And it's a great way to describe it. So there is a tension between sometimes parental and their child, particularly around transition to adulthood. But there is going to be those different needs and wants, whereas a parent may be able to see more into the future because they've got more of that life experience to look into that, whereas a child might be not able to do that just yet based on their age or their abilities. So there's a lot of things to consider there.
Definitely. And we know from previous research that children and parent priorities related to goal setting are different. So we know that's going to be something that we come up with as a barrier. And I guess then on the flip side, some of the areas that didn't reach a lot of consensus, which some of them were a little surprising to me perhaps, were around the frameworks and tools that therapists use
Yeah.
And so I think therapists are drawing from lots of different things because we don't have perhaps some really well-established child-led goal-setting tools that are appropriate for a multidisciplinary team. COPM came up as a really big one, which isn't surprising, but also it's a content-empty tool, so the content needs to be established through discussion with the child, which we can imagine for some children is a little bit more difficult.
True, yeah.
And therapists did say that things like using concrete examples can help children who are younger to be able to establish goals, but we don't yet have a really well-established tool that's used across lots of different disciplines. Perhaps so there were some gaps identified as well, which will be interesting for future research.
That's so interesting. And I always think about when we're setting goals and when you sort of go through that real interview process through the COPM, it can be quite lengthy as you explore these different areas. And if you're trying to give examples to children, you also have to be careful not to put words into their mouth either, kind of like, leading them in a way that you think they might need to go into. So I can imagine looking for a good assessment tool to help us to set goals, given it's so important.
Yes.
Be really vital.
And that said, there are some lovely tools out there that are used, like, for example, the PEGS, the Perceived Efficacy and Goal Setting System. But some of these tools are perhaps a bit more commonly used by one discipline. So thinking about a multidisciplinary team who may want to set goals together as a group, then we may need to look a little bit more broadly at tools for that setting.
And I imagine there's so many more results that I know that there'll be a lot to look at there. But I guess from here now, from what you found through this whole process, what would be your top 3 tips for clinicians if you really wanted to support this real child-led goal-setting practices? What would be those top 3 that you would sort of really want people to walk away with?
I would say 3 comments from participants that sort of stood out to me. One would be we really need to give children a chance and not assume their competence just because we may think a child who's younger can't set goals.
Good point.
And we've got some really nice results when we publish that I would encourage therapists to read about what might be the factors that can indicate a child's ready, but age wasn't one of them.
Wow.
So I think it's really important to let children have a try. Because we know that, building self-determination skills needs to happen early later on in life. So they can learn through the process of trying to set a goal and perhaps
that starts
not
really
getting
early
it right.
on. That's really practical. I love that.
And another thing that came out as a consensus item was trying not to have your own therapist agenda. So I think again, it's about relinquishing a little bit of control over to the child and family to let them lead us through what's important to them, and then really trying to support them with those things. So that would be 2, and then I guess the third one would be that it's also really important that children are involved sort of all through the process. So identifying goals is one step, but that's really the first step. There's then a process that goes on from there where we address the child's goals and getting children to be involved in coming up with what the plan for that might be and then evaluating at the end. So we need to think about goal setting as sort of a whole process that starts at the very first meeting with the child but really continues through that intervention process. And again, I think there's going to be lots of really nice guidance for therapists when we publish, which will help them through that process and to really pick apart what those steps are.
Wonderful. Well, look, I can't wait for that publication, so I'll stay tuned for that. Make sure you keep me up to date with that so we can talk to you again when that all happens. But it's just so lovely to hear all the findings that you have found through this whole survey. It is so consistent with a lot of the themes that are in this conference already. We're talking, again, I can't help but to relate to the transition to adulthood and one of the key tips that clinicians and researchers are saying, and it's self-advocacy, it's teaching that. And how do we do it? Well, let's do it early on. And if goal setting is such an important ingredient, which I just spoke about with Professor Rosalind Boyd, well, they're all so tied in, and it's not too overwhelming as clinicians. There's this key factors that we can implement in our practice, and your work is an important piece of the puzzle for that.
And the other thing I would say is that, it's not always straightforward, but it takes time and practice. But I think more we help children to be involved, the more we learn about how to do that better.
Great. That's so great. Well, thank you so much for joining us.
Thank you.
And for sharing more of your work today. I think now you can just sit back and relax and enjoy the conference.
Yes, and eat this delicious food.
And eat your food, that's right. Eat your food. So thank you for joining us. to everyone who's listening, remember you can get links to this on the website, researchworks.net. Hope you enjoy the series. We'll talk to you all again really soon with another guest. Talk to you soon. Bye.